Hello and hi to the lecturer. So today our group will do the presentation on the topic strategic procurement planning in community pharmacy. So here are our group member which consists of Nurin Najwa, Nurin Shahirah, Aina Shafiqah and Logeswari. Here are the presentation outline whereby our group member will be presenting on this topic.
So what is procurement planning in community pharmacy? Procurement planning in community pharmacy is purchasing the medication supplies and machinery required for a pharmacy's operation. It also includes a sustainable inventory management, which takes into account social, environment, and economic factors. The ultimate goal of procurement planning on community pharmacy is to obtain efficient inventory systems in order to preserve ideal stock level, cut waste, and expedite the procurement process. This is highlighted as business decisions also taken into account, as well as the needs on serving customers and its satisfaction. In the overview of procurement, here are some key points that have to be highlighted, which are the first one is logistic management, which is it will affect supply chain, cost, and availability. Second is procurement decisions, which will be influenced by both professional and financial consideration. The third one is choosing suppliers, which is it depends on the supplier dependability, product availability, and quality assurance. And the last one is budget discussions to maintain a sufficient model funds throughout the operational period.
So hello to my lecturers and my fellow friends. My name is Logeshwari. So today I will be presenting about the procurement strategies in community pharmacy. First of all, procurement is essential for ensuring a steady supply of medicines and controlling costs. Moreover, strategic sourcing helps select reliable suppliers based on price, quality, and delivery performance. In addition, inventory management tools like just-in-time and ABC analysis reduce waste and prevent stockouts. At the same time, good supply relationship improve flexibility and help manage supply disruptions. Moreover, technology integration, such as e-procurement systems, enhances accuracy and decision making. Furthermore, effective procurement reduces excess stock, lowers storage costs, and boosts efficiency. Last but not least, quality assurance through trust suppliers ensures safety, reliable medications, build patient trust. That's all from me. Next, I'd like to pass it to my friends. Thank you. So, hello to my lecturers and my fellow friends. Moreover, I'll be presenting about the sustainable approaches to inventory management. First of all, technology integration, such as use computerized system to track stock levels, expiry dates, and sales in real time to reduce waste and avoid stock issues. Moreover, just-in-time inventory, such as order medicines based on accurate demand forecasts to minimize overstocking, reduce storage costs, and prevent drug expiration. In addition, supplier collaboration, such as partner with ethical and reliable suppliers to improve delivery efficiency, enable bulk purchasing, and reduce packaging waste. Moreover, demand forecasting, such as analyze trends, demographics, and prescription patterns to predict stock needs accurately and manage seasonal demands. Last but not least, regulatory compliance and staff involvement ensure adherence to disposal laws and engage staff in inventory process to foster accountability and environmental responsibility. That's all from me. Next, I would like to pass it to my friends. Thank you so much.
Hello and hi everyone. My name is Nurin Shahira. So I will continue the presentation with I will briefly highlight the key challenges and solutions in procurement planning for community pharmacies. So pharmacies face several obstacles including inaccurate demand forecasting, unreliable suppliers and strict regulatory compliance. Also, budget limitation and poor inventory management complicate the operation. On top of that, there's a growing pressure to adopt environmentally sustainable practice. Next is solution in procurement planning. To address issue that I mentioned previously, what we can do first is forecasting tools whereby automated inventory system is implemented. Secondly is supplier management whereby consistent communication performance.
Assalamualaikum, my name is Nuri
monitoring
Najwa
can
and
be
I will
do.
continue the
And
presentation
then next
regarding
is
the summary
to
of key
monitor
findings
the
from our assignment.
regulatory
The first key
readiness,
finding from our assignment
whereby
is the role of
continuous
community pharmacists.
sub-training
They are
will be
really important as they
implemented.
play the role of
Next,
the
we
most
can
accessible healthcare
also
providers for the
monitor
community.
the cost control
The second
by
key finding is
consider
procurement and
bulk
supply of
buying,
medicines.
BPO, and
Procurement is very important
affordable
as it ensures
generic.
availability,
Moving
affordability,
on to
and
the
rational use of
efficient
certain medicines.
inventory
The
system,
usual challenges
whereby
encountered
FIFO and
within the
FIFO
procurement and supply of
practices
medicines are
can be
inconsistent supply
implemented.
chains,
And
budget
last
constraints, and poor forecasting.
but not least is green procurement, whereby eco-friendly supplier, digital record, and take-back programs should be considered. Moving on to the entrepreneurial perspective in strategic procurement. So this approach goes beyond traditional method to add real value in pharmacy operation. So let's start with the first point, whereby introduction to the entrepreneurial approach. Here, procurement is viewed not as a routine task but as a strategic opportunity. So this empowers pharmacies to think innovatively, manage risk proactively, and tap into new market opportunities. Next, under innovation and technology integration, you can see the emphasis on tools like AI and e-procurement system, as well as supplier diversification, which enhances both efficiency and resilience. Moving on to the value-added procurement. This is where strategies like bulk deals, exclusive contract, and private label sourcing come in, helping pharmacies to expand their product offering and market reach. So then we have risk management and collaboration. Entrepreneurial pharmacies stay agile by monitoring trends and working together through cooperative or alliances for stronger purchasing power. And finally, sustainability and ethics focuses on environmentally responsible sourcing and waste reduction practices that align with modern consumer values. So all in all, these elements make procurement powerful driver of innovation, sustainability, and growth in community pharmacy.
The third key finding is regarding the inventory control, storage, and distribution. An effective inventory control helps in minimizing the stockouts and expiry-related losses, while for proper distribution mechanisms, it ensures the safe and efficient delivery from the wholesalers to the community pharmacies. The next finding is sustainable practices. Sustainability involves in balancing economic growth, social well-being, and environmental care. And a few ways like minimizing pharmaceutical waste and promoting electronic prescriptions can be done to reduce the environmental impact. The last main finding is entrepreneurial opportunities, in which pharmacies are evolving from dispensers to healthcare entrepreneurs offering extended services. This can be seen from innovation in business models like creation of online pharmacies and collaboration of community pharmacies with other healthcare providers to enhance the services they provide. Moving on to the practical recommendations for community pharmacies, the first recommendation for them would be to embrace patient-centered rules. This is due to the shifting of pharmaceutical field from product-based to patient-focused care, and it can be done by prioritizing drug counseling, medication safety and health promotion, and also medication adherence. The second suggestion would be to uphold professional standards by following the Ministry of Health guidelines, which is the community pharmacy benchmarking. They have to maintain professional appearance that complies with laws, and also they have to conduct regular audits and support staff training. The third suggestion for community pharmacies is to expand service offerings. For example, they can provide preventive care like health screenings, and also they can collaborate with other healthcare providers to offer better pharmacy services. And lastly, the community pharmacies are recommended to maintain ethical practice and confidentiality. It is to ensure the professionalism, integrity, and privacy of patients in all interactions. It will also strengthen the public trust in our rules and profession's credibility. Now, we are going to the future perspectives in sustainable procurement. The first future perspective that can be seen is the shift to value-based procurement. This shift focuses on the health outcomes and cost effectiveness over the price of the medications alone. It also supports the transparent pricing and resource optimization. Secondly, is regarding the management of essential medicines. This can be done by utilizing the Malaysia's essential medicines list. It encourages joint procurement between the public and community sectors. And by managing these essential medicines, it helps in reducing waste and helps in better forecasting of stocks, along with the assistance of AI-driven inventory systems. The third future perspective is diversification of supplier networks. This will reduce risk of reliance on only one supplier, and it can be learned from the MOH's multi-vendor contract approach. The fourth point is promoting environmental sustainability. This can be done by the community pharmacies by adopting eco-friendly packaging and lessen the single use of plastics. And by collaborating with green certified manufacturers will also help in promoting the sustainability. The last future perspective in sustainable procurement is the strengthening bond between private and public collaboration. This can be done by integrating community pharmacies into more national health programs. This will enable cost-sharing models to reduce patient expenses and support consistent medicine supply through coordinated frameworks.